Hello and welcome to On Call After Hours, where we answer the questions we didn't get to during our regular show. All of your questions are important to us and we want to answer as many as we can for you. First question from Nanda. Husband has MS. He's had rectal surgery and now has fluid pockets that have a foul odor. Discuss.
I guess I probably would need to know more information. I guess I'm not sure what the fluid pockets are or what if we're talking about pockets on the outside such as abscesses, perianal abscesses that need to be drained. That would probably be how I would approach that.
Diverticulitis ever cause a foul odor?
Usually not. They usually have more pain and fevers and abdominal pain.
From Del Rapids, husband has colon cancer. Genetics, what factor does family history and genetics have with colon cancer risk? Eric?
Well, it's important, and like we said before, the first-degree relatives, mom, dad, brother, sister, I think increases your risk significantly if those relatives have had colon cancer. And as far as recommended colonoscopy, certainly they around age 45 to 50, or if the relative had colon cancer rather early age, about 10 years before when they were diagnosed.
So start at 40 if they had it early. But 50 would be for most of us then.
45 to 50, yeah.
Esteline, discuss Giardia. Scott.
Well, that's a bacteria that we usually don't see in the wintertime, but you can see in the summertime people that hike in out in the wilderness or drink well water. It's a bacteria that protozoan actually that can cause some inflammation and diarrhea, can easily be treated with antibiotics once it's diagnosed.
That'll give you a foul odor and some bloating discomfort. Yankton, diarrhea off and on for a month and red stool. Should they be concerned?
Yes.
Get in. Absolutely. Sioux Falls, can long-term use of antibiotics cause colon inflammation or other issues quickly? Antibiotic.
Yeah, long-term antibiotics can cause C. diff colitis. Not a good thing.
Terrible illness.
Yeah. Yep.
Do you believe in probiotics?
I think in certain cases probiotics helps. It's good to restore the normal bacteria to the colon.
Yeah. You take you promote probiotics
On occasion.
Okay. Here's from I have not been able to walk nor stand for over 8 years because of inclusion cell myopathy plus heart problems. Would I have a greater chance of problems caused during the colostomy? Therefore, the necessity a cardiology team immediately onset prior to a colostomy. So he had to have a colostomy and had to have a cardiac team, and I guess he's wondering about chance of problems doing the colostomy.
Colonoscopy?
I think maybe he meant colonoscopy. That must be it. He's got some heart problems. How safe is a colonoscopy?
Well, the colonoscopy is probably independent of his risk factors from his heart disease. His heart disease risk factors are probably more related to the anesthesia than the colonoscopy, the procedure itself. So,
I generally say the risk, for cardiac-wise, pretty safe unless you're in heart failure. Mm-hmm. You've got a normal heart rate and a reasonable blood pressure, and you're reasonably stable. Get the colonoscopy. Agree? Aberdeen, symptoms of Crohn's disease. Is it hereditary? Eric, Crohn's disease. Is it hereditary?
It certainly can run in some families, but there's probably the vast majority of people we see with Crohn's disease do not have a family member with it. So.
Okay. Spearfish, age 50, pedunculated polyps. 3 years later, found more polyps, but said they were normal. Is it okay to wait 7 years?
Well, the recommendation is 3 to 5 years after you find polyps, adenomatous type polyps. I assume that that's what they meant by the second colonoscopy. They found polyps. It was normal, it was okay. So I would probably urge them to be a little sooner than later.
Yeah, I'd say 5 if they've, or 3 if there's multiple polyps. Huh?
Right.
Sioux Falls, discuss the benefit of bidet, better for cleaning, washing compound, wiping toilet paper, wiping. Washing found in European, Asian cultures. Do you understand any of that? A bidet. That's it, a bidet. What about bidet, French bidet, cleansing with a bidet? I'm all for it. I wish we had it here. What do you think?
I suppose if they want to go through the expense of that, I guess, but there's probably a little easier way to maybe just hop in the shower afterwards or something.
Yeah, I like the idea of cleansing, but too much cleansing is the problem. too, for many people, and they get
Certainly for pruritus ani, when you get that itching and irritation on the skin, constantly cleansing and rubbing with soap and water is probably counterproductive, actually.
Yeah. I have found, and this is through Jim, a dermatologist friend of mine who said that we should be using CeraVe, which is a nice cream that holds moisture in. So after cleansing, use a little CeraVe on it, C-E-R-A capital V-E. And Wagner, what is mesenteric sclerosis? Mesoenteritis sclerosis. Mesoenteritis sclerosis. Do you know?
Well, there are patients that get inflammation and scar tissue in the mesentery. It's not very common. Most of the time we don't do anything about it, but it's we see it occasionally. We probably see it more since we've started doing CAT scans, and we see the
Right.
fatty tissue more. But I don't know, Scott. It's not a real
Yeah, I've
common
seen it
thing.
once or twice too, and it's exactly as it sort of sounds. You get a scarring and inflammation of the mesentery, which really is, I mean, you see it more on CT scans.
And it doesn't cause major problems. You don't generally do surgery for them.
No.
Well, sometimes you just have to make sure it's not something else that
Some kind
other
of weird
type, like a
cancer.
lymphoma or some
Yeah.
other type of problem that might require, well, it would require treatment. But most of the time, if that's what it ends up being, and sometimes you biopsy it and you just see the scar tissue, and if that's the case, you don't do much about it.
I was blocking on the dermatologist Jim McGran. I kept wanting to say another last name, but McGran was really recommends CeraVe, and I recommend after you wipe gently, you smear all of the CeraVe on there, and then you wipe that away, and it leaves you with a better rear end, and you don't need to have the bidet. And the last question: what keeps a patient from waking up during a procedure?
Well, some of it's dependent on if you have an anesthesiologist that's involved, and depending on what kind of drugs they monitor sort of on a minute-to-minute basis. And certainly you're not out completely. It's more of a sedative type twilight anesthesia where you're sedated. You certainly can wake up. There's no problem waking up. You can even watch the colonoscopy. The things we worry about is pain and discomfort from the procedure itself, and so that's what we really try to prevent.
Make sure that anything to take.
No, I would agree. I think there are a lot of people, if they're comfortable and we're on our way out, which for the most part is not the a painful part of the procedure. If they wake up and they're comfortable and they're looking at the screen, the nurse will say, "Are you comfortable?" And if they say they are, then they won't necessarily give them any more medicine. If they seem to be uncomfortable, then for sure we'll
Give them something more.
give them something more.
Yeah. Well, we appreciate your joining us and giving us these extra questions, and thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Television at 7 p.m. and call in or email your questions. Until next time, stay healthy out there.